أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ياسين والقرآن الحكيم إنك من المرسلين على صراط مستقيم تنزيل العزيز الرحيم لتنذر قوما ما أنذر آباؤهم فهم غافلون لقد حق القول على أكثرهم فهم لا يؤمنون إنا جعلنا في أعناقهم أغلالا فهي إلى الأذقان فهم مقمحون وجعلنا من بين أيديهم سدا ومن خلفهم سدا فأغشيناهم فهم لا يبصرون وسواء عليهم أنذرتهم أم لم تنذرهم لا يؤمنون إنما تنذر من اتبع ذكر خشي الرحمن بالغيب فبشر مغفرة وأجر كريم. إنا نحن نحيي الموتى ونكتب ما قدموا وآثارهم وكل شيء أحصيناه في إمام مبين واضرب لهم مثلا أصحاب القرية إذ جاءها المرسلون إذ أرسلنا إليهم اثنين فكذبوهما فعززنا بثالث فقالوا إنا إليكم مرسلون قالوا ما أنتم إلا بشر مثلنا وما أنزل الرحمن من شيء إن أنتم إلا تكذبون قالوا ربنا يعلم إنا إليكم لمرسلون وما علينا إلا البلاغ المبين قالوا إنا تطيرنا بكم لئن لم تنتهوا لنرجمنكم وليمسنكم منا عذاب أليم قالوا طائركم معكم أين ذكرتم بل أنتم قوم مسرفون وجاء من أقصى المدينة رجل يسعى قال يا قوم اتبعوا المرسلين اتبعوا من لا يسألكم أجرا وهم مهتدون وما لي العبد الذي فطرني وإليه ترجعون أتخذ من دونه آلهة يردني الرحمن ضر لا تغني عني شفاعتهم شيئا ولا ينقذون إني ذل في ضلال مبين إني آمنت بربكم فاسمعون قيل ادخل الجنة قال يا ليت قوم يعلمون بما غفر لي ربي وجعلني من المكرمين وما أنزلنا على قومه من بعده من جند من السماء وما كنا منزلين إن كانت إلا صيحة واحدة فإذا هم خامدون يا حسرة على العباد ما يأتيهم من رسول إلا كانوا به يستهزئون ألم يروا كما أهلكنا قبلهم من القرون أنهم إليهم لا يرجعون وإن كل لما جميع لدينا محضرون وآية لهم الأرض الميتة أحييناها وأخرجنا منها حبا فمنه يأكلون وجعلنا فيها جنات من نخيل وأعناب فجرنا فيها من العيون ليأكلوا من ثمره وما عملته أيديهم أفلا يشكرون سبحان الذي خلق الأزواج كلها مما تنبت الأرض من أنفسهم ومما لا يعلمون وآية لهم الليل نسلخ منه النهار فإذا هم مظلمون والشمس تجري لمستقر لها ذلك تقدير العزيز العليم والقمر قدرناه منازل حتى عاد كالأرجون القديم لا الشمس ينبغي لها أن تدرك القمر ولا الليل سابق النهار وكل في فلك يسبحون وآية لهم أن حملنا ذريتهم في الفلك المشحون وخلقنا لهم من مثله ما يركبون وإن نشأ نغرقهم فلا شريك لهم ولا هم ينقذون إلا رحمة منا ومتاعا إلى حين وإذا قيل لهم اتقوا ما بين أيديكم وما خلفكم لعلكم ترحمون وما تأتيهم من آية من آيات ربهم إلا كانوا عنها معرضين وإذا قيل لهم أنفقوا مما رزقكم الله قال الذين كفروا للذين آمنوا أنطعم من لو يشاء الله أطعمه إن أنتم إلا في ضلال مبين ويقولون متى هذا الوعد إن كنتم صادقين ما ينظرون إلا صيحة واحدة تأخذهم وهم يخصمون فلا يستطيعون توصية ولا إلى أهلهم يرجعون وانفخ في الصور فإذا هم من الأجداث إلى ربهم ينسلون قالوا يا ويلنا من بعثنا من مرقدنا هذا ما وعد الرحمن صدق المرسلون إن كانت إلا صيحة واحدة فإذا هم جميع لدينا محضرون فاليوم لا تظلم نفس شيئا ولا تجزون إلا ما كنتم تعملون إن أصحاب الجنة اليوم في شغل فاكهون هم وأزواجهم في ظلال على الأرائك متكئون لهم فيها فاكهة ولهم ما يدعون سلام قولا من رب رحيم وامتازوا اليوم أيها المجرمون ألم أعهد إليكم يا بني آدم أن لا تعبدوا الشيطان إنه لكم عدو مبين وأن اعبدوني هذا صراط مستقيم ولقد أضل منكم جبلا كثيرا أفلم تكونوا تأكلون هذه جهنم التي كنتم توعدون اصلحوا اليوم بما كنتم تكفرون اليوم نختم على أفواههم وتكلمنا أيديهم وتشهد أرجلهم بما كانوا يكسبون ولو نشاء لطمسنا على أعينهم فاستبقوا الصراط فأنى يبصرون ولو نشاء لمسخناه على مكانتهم فما استطاعوا هزيا ولا يرجعون ومن نؤمره نكس في الخلق أفلا يأكلون وما علمناه شعر ما ينبغي له إن هو إلا ذكر وقرآن مبين لينذر من كان حيا يحق القول على الكافرين أولم يروا أن خلقنا لهم مما عملت أيدينا أنعاما فهم لها مالكون وذللناها لهم فمنها ركوبهم ومنها يأكلون ولهم فيها منافع ومشارب أفلا يشكرون واتخذوا من دون الله آلهة لعلهم ينصرون لا يستطيعون نصرهم وهم لهم جند محضرون فلا يحزنك قولهم إنا نعلم ما يسرون وما يعلنون أولم يرى الإنسان أن خلقناه من نطفة فإذا هو خصيم مبين فضرب لنا مثلا ونسي خلقه قال من يحيي العظام وهي رميم قل يحييها الذي أنشأها أول مرة وهو بكل خلق عليم الذي جعل لكم من الشجر الأخضر نارا فإذا أنتم منه توقدون أوليس الذي خلق السماوات والأرض بقادر ألا يخلق مثلهم بلى وهو الخلاق العليم إنما أمره إذا أراد شيئا أن يقول له كن فيكون فسبحان الذي بيده ملكوت كل شيء وإليه ترجعون صدق الله العلي العظيم الفاتحة بسم الله الرحمن الرحيم
Bismillahirrahmanirrahim. Allahumma salli ala Muhammadin wa ala Muhammad. Allahumma salli ala Muhammadin wa ala Muhammad. اللهم إني أسألك برحمتك التي وسعت كل شيء وبقوتك التي قهرت بها كل شيء وخضع لها كل شيء وذل لها كل شيء وبجبروتك التي غلبت بها كل شيء وبعزتك التي لا يقوم لها شيء وبعظمتك التي ملأت كل شيء وبسلطانك الذي على كل شيء وبوجهك الباقي بعد فناء كل شيء وبأسمائك التي ملأت أركان كل شيء وبعلمك الذي أحاط بكل شيء وبنور وجهك الذي أضاء له كل شيء يا نور يا قدوس يا أول الأولين ويا آخر الآخرين اللهم اغفر لي الذنوب التي تحت كل عصام اللهم اغفر لي الذنوب التي تنزل النقام اللهم اغفر لي الذنوب التي تغير النعم اللهم اغفر لي الذنوب التي تحبس الدعاء اللهم اغفر لي الذنوب التي تقطع الرجاء اللهم اغفر لي الذنوب التي تنزل البلاء اللهم اغفر لي كل ذنب أذنبت وكل خطيئة أخطأتها اللهم إني أتقرب إليك بذكرك وأستشفع بك إلى نفسك وأسألك بجودك أن تدنيني من قربك وأن توزعني شكرك وأن تلهمني ذكرك اللهم إني أسألك سؤال خاذ متذلل خاشع أن تسامحني وترحمني وتجعلني بقسمك راضيا قانعا وفي جميع الأحوال متواضعا اللهم وأسألك سؤال من اشتدت فاقته وأنزل بك عند الشدائد حاجة وعظم فيما عندك رغبته اللهم عظم سلطانك وعلى مكانك وخفي مكرك وظهر أمرك وغلب قهرك وجرت قدرتك ولا يمكن الفرار من حكومتك اللهم لا أجد لذنوبي غافرا ولا لقبائه ساترا ولا لشيء من عملي القبيح بالحسن مبدلا غيرك لا إله إلا أنت سبحانك وبحمدك ظلمت نفسي وتجرعت بجهلي وسكنت إلى قديم ذكرك لي ومنك علي اللهم مولاي كم من قبيح سترت وكم من فاضح من البلاء يقلت وكم من عثار وقيت وكم من مكروه دفعت وكم من ثناء جميل لست أهلا له نشرت اللهم عظم بلائي وأفرت بي سوء حالي وقصرت بي أعمالي وقعدت بي أغلالي وحبسني عن نفعي بعد عملي وخدعتني الدنيا بغرورها ونفسي بجنايتها ومثالي يا سيدي فأسألك بعزتك أن لا يحجب عنك دعائي سوء عملي وفعالي ولا تفضحني بخفي ما اطلعت عليه من سري ولا تعاجلني بالعقوبة على ما عملته في خلواتي من سوء فعلي وإساءتي ودوام تفريطي وجهالتي وكثرة شهواتي وغفلتي وكن اللهم بعزتك لي في كل الأحوال رؤوفا وعلي في جميع الأمور عطوفا إلهي وربي من لي غيرك أسأله كشف ذري والنذر في أمري إلهي ومولاي أجريت علي حكما اتبعت فيه هوى نفسي ولم أخترس فيه من تزيين عدوي فغرني بما أهوى وأسعده على ذلك القضاء فتجاوزت بما جرى علي من ذلك بعد حدودك وخالفت بعد أوامرك فلك الحمد علي في جميع ذلك ولا حجة لي فيما جرى علي فيه قضاؤك وألزمني حكمك وبلاؤك وقد أتيتك يا إلهي بعد تقصيري وإسرافي على نفسي معتذرا نادما منكسرا مستقيلا مستغفرا منيبا مقرا مذعنا معترفا لا أجد مفرا مما كان مني ولا مفزعا أتوجه إليه في أمري غير قبولك عذري وإدخالك إياي في ساعة رحمتك اللهم فاقبل عذري وارحم شدة ضري وفكني من شد وثاقي يا رب ارحم ضعف بدني ورقة جلدي ودقة عظمي يا من بدأ خلقي وذكري وتربيتي وبري وتغذيتي هبني لابتداء كرمك وسالف برك بي يا إلهي وسيدي وربي أتراك معذبي بنارك بعد توحيدك وبعد ما انتوى عليه قلبي من معرفتك ولهج به لساني من ذكرك واعتقده ضميري من حبك وبعد صدق اعترافي ودعائي خاضعا لربوبيتك هيهات أنت أكرم من أن تضيع من ربيت أو تعبد من أدنيت أو تشرد من آويت أو تسلم إلى البلاء من كفيته ورحمت وليت شعري يا سيدي وإلهي ومولاي أتسلط النار على وجوه خرت لعظمتك ساجدة وعلى ألسن نطقت بتوحيدك صادقة وبشكرك مادحة وعلى قلوب اعترفت بإلهيتك محققة وعلى ضمائر حوت من العلم بك حتى صارت خاشعة وعلى جوارح ساعت إلى أوطان تعبدك طائية وأشارت باستغفارك مذعنا ما هكذا الظن بك ولا أخبرنا بفضلك عنك يا كريم يا ربي وأنت تعلم ضعفي عن قليل من بلاء الدنيا وعقوباتها وما يجري فيها من المكاره على أهلها على أن ذلك بلاء ومكروه قليل مكثوه يسير بقاؤه قصير مدته فكيف احتمالي لبلاء الآخرة وجليل وقوع المكاره فيها وهو بلاء تطول مدته ويدوم مقامه ولا يخفف عن أهله لأنه لا يكون إلا عن غضبك وانتقامك وسخطك وهذا ما لا تقوم له السماوات والأرض يا سيدي فكيف لي وأنا عبدك الضعيف الذليل الحقير المسكين المستكين يا إلهي وربي وسيدي ومولاي لأي الأمور إليك أشكو ولما منها ضج وأبكي لأليم العذاب وشدتي أم لطول البلاء ومدتي فلئن سيرتني للعقوبات مع أعدائك وجمعت بيني وبين أهل بلائك وفرقت بيني وبين أحبائك وأوليائك فهبني يا إلهي وسيدي ومولاي وربي صبرت على عذابك فكيف أصبر على فراقك وهبني صبرت على حر نارك فكيف أصبر عن النظر إلى كرامتك أم كيف أسكن في النار ورجائي عفوك فبعزتك يا سيدي ومولاي أقسم صادقا لئن تركتني ناطقا لأذجن إليك بين أهلها أذجيج الآملين ولا أصرخن إليك صراخ المستصرخين ولا أبكين عليك بكاء الفاقدين ولو نادينك أين كنت يا ولي المؤمنين يا غاية آمال العارفين يا غياث المستغيثين يا حبيب قلوب الصادقين ويا إله العالمين أفتراك سبحانك يا إلهي وبحمدك تسمع فيها صوت عبد مسلم سجن فيها بمخالفتي وذاق طعم عذابها بمعصيتي وحبس بين أطباقها بجرمه وجريرتي وهو يضج إليك ضجيج مؤمل لرحمتك ويناديك بلسان أهل توحيدك ويتوسل إليك بربوبيتك يا مولاي فكيف يبقى في العذاب وهو يرجو ما سلف من حلمك أم كيف تؤلمه النار وهو يعمل فضلك ورحمتك أم كيف يحرقه لهيبها وأنت تسمع صوته وترى مكانه أم كيف يشتمل عليه زفيرها وأنت تعلم ضعفه أم كيف يتقلقل بين أطباقها وأنت تعلم صدقه أم كيف تزجره زبانيتها وهو يناديك يا رب أم كيف يرجو فضلك في عتقه منها فتتركه فيها هيهات ما ذلك الظن بك ولا المعروف من فضلك ولا مشبه لما عملت به الموحدين من برك وإحسانك فباليقين يقطع لولا ما حكمت به من تعذيب جاحدك وقضيت به من إخلاد معاندك لجعلت النار كلها بردا وسلاما وما كان لأحد فيها مقرا ولا مقاما لكنك تقدست أسماؤك أقسمت أن تملاها من الكافرين من الجنة والناس أجمعين وأن تخلد فيها المعاندين وأن تجل ثناؤك قلت مبتدئا وتطولت بالإنعام متكرما أفمن كان مؤمنا كمن كان فاسقا لا يستوون إلهي وسيدي فأسألك بالقدرة التي قدرتها وبالقضية التي حتمتها وحكمتها وغلبت من عليه أجريتها أن تهب لي في هذه الليلة وفي هذه الساعة كل جرم أجرمت وكل ذنب أذنبت وكل قبيح أسررت وكل جهل عملته كتمته أو أعلنت أخفيته أو أظهرت وكل سيئة أمرت بإثباتها الكرام الكاتبين الذين وكلتهم بحفظ ما يكون مني وجعلتهم شهودا علي مع جواره وكنت أنت الرقيب علي من ورائهم والشاهد لما خفي عنهم وبرحمتك أخفيت وبفضلك سترت وأن توفر حظي من كل خير أنزلت أو إحسان فضلت أو بر نشرت أو رزق بسطت أو ذنب تغفره أو خطأ تستر Ya Rabbi, Ya Rabbi, Ya Rab, Ya Ilahi wa Sayyidi wa Mawlaya wa Malika Riqqi, Ya man biyadihi nasiyati, Ya aliman bidhurri wa maskanati, Ya khabiran bifaqri wa fawqati. Ya Rabbi, Ya Rabbi, Ya Rab, أسألك بحقك وقدسك وعظم صفاتك وأسمائك أن تجعل أوقاتي من الليل والنهار بذكرك معمورة وبخدمتك موصولة وأعمالي عندك مقبولة حتى تكون أعمالي وأورادي كلها وردا واحدا وحالي في خدمتك سرمدا. يا سيدي يا من عليه معولي يا من إليه شكوت أحوالي. يا ربي يا ربي يا رب، قوي على خدمتك جوارحي واشدد على العزيمة جوانه وهب لي الجد في خشيتك والدوام في الاتصال بخدمتك حتى أسرح إليك في ميادين السابقين وأسرع إليك في البارزين واشتاق إلى قربك في المشتاقين وأدنو منك دنو المخلصين وأخافك مخافة الموقنين واجتمع في جوارك مع المؤمنين. اللهم ومن أرادني بسوء فارد ومن كادني فكد واجعلني من أحسن عبيدك نصيبا عندك وأقربهم منزلة منك وأخصهم زلفة لديك، فإنه لا ينال ذلك إلا بفضلك، وجد لي بجودك واعطف علي بمجدك واحفظني برحمتك واجعل لساني بذكرك لهجا وقلبي بحبك متيما ومن علي بحسن إجابتك وأقلني عثرتي واغفر زلتي، فإنك قضيت على عبادك بعبادتك وأمرتهم بدعائك وضمنت لهم الإجابة. فإليك يا ربي نسبت وجهي وإليك يا ربي مددت يدي، فبعزتك استجب لي دعائي وبلغني منايا ولا تقطع من فضلك رجائي. واكفني شر الجن والإنس من أعدائي. يا سريع الرضا اغفر لمن لا يملك إلا الدعاء، فإنك فعال لما تشاء. يا من اسمه دواء وذكره شفاء وطاعته غنى، ارحم من رأس ماله الرجاء وسلاحه البكاء. يا سابغ النعم يا دافع النقم يا نور المستوحشين في الظلام يا عالما لا يعلم، صل على محمد وآل محمد وافعل بي ما أنت أهل. وصلى الله على رسوله والأئمة الميامين من آله وسلم تسليما كثيرا. سورة المباركة الفاتحة.
Can we request the ladies to come in to the main hall, inshallah? Can we request the ladies to please come to the main hall? And thank you, gents, for moving to the left. Jazakallah. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Guest speaker, Dr.Tazeen Zaidi. Respected elders, brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. Surah Al-Fatiha is requested for the Isala Sawab of Marhumin listed on the screen, and for all Marhumin, Al-Fatiha. Amma Yujib is requested for the names listed on the screen, and for all those in need here and elsewhere. Let us recite together. Bismillah ar-Rahman ar-Rahim. Amma yujibul muttarra idha da'a wa yakshifu as-su. Amma yujibul muttarra idha da'a wa yakshifu as-su. أما يجيب المضطر إذا دعاه ويكشف السوء أما يجيب المضطر إذا دعاه ويكشف السوء أما يجيب المضطر إذا دعاه ويكشف السوء اللهم صل على محمد وآل محمد. Special program, Chai and Chat with legendary Indian cricketer Saeed Kirmani. Join us for a special evening tomorrow, Friday, November 18th at 8 p.m. for a fireside chat with 1983 World Cup cricketer Saeed Mujtaba Kirmani, as Dr. Shabir Kirmani chats with him about excellence, teamwork, overcoming obstacles, and how your faith can inspire you to be the best. Tafakkur and Tadabbur talks. The Quran invites us to tafakkur, which is thinking and contemplating, and tadabbur, which is pondering and reflecting on themes and ideas in order to guide us to a better world, here and the hereafter. In an effort to enjoin these Quranic injunctions, we are initiating a new series that share ideas and personal journeys on topics such as leadership, history, nature, science, and commerce. The first program for this series will be on Wednesday, November 30th at 8 p.m. Our guest speaker will be Dr. Abbas Sivji, world-renowned physicist who has a glacier named after him, and the topic will be Between Two Poles, Life Lessons Learned Between the North and South Pole. Masjid al-Hayy program survey. To provide the community with the most impactful programming, we would like to obtain your feedback on the type of programming which would be most beneficial to you, your friends, family, and ultimately the community at large. To this end, we request you to take a few minutes to provide your insights to the brief survey found either in the latest newsletter, or you can go to the link on the screen, which is tinyurl.com/MAH Program Survey 2022. Tonight, we would like to welcome Dr. Tazeen Zaidi to Masjid al-Hayy and thank her for conducting an informative and interactive program here. Dr. Zaidi is a board-certified family medicine doctor in Sanford and has a special interest in women's health and preventative health care. Dr. Zaidi's compassionate nature, along with her diverse medical experience, makes her a valuable asset to this community. She is affiliated with multiple hospitals in the area, including Advent Altamont, Orlando Health, and HCA. She has received her medical degree from People's University of Medical and Health Sciences, Nawab Shah, and has been in practice for more than 20 years. She speaks English, Urdu, and Arabic. Let us invite Dr. Zaidi with a loud salawat ala Muhammad wa ali Muhammad.
Assalamu alaikum. For my help and support is my husband, Dr. Zaidi. We own a practice in Sanford area, Access Family Care. First of all, I would really like to thank everyone for giving us the opportunity to come and speak with you all. A lot of my brothers and sisters are familiar with me, and I know a lot of them through community as well as coming to our practice. My main interest today is to, sorry. Okay, sure. Thank you so much. The main interest today is to, first of all, introduce ourselves to our rest of the community, and then to try to bring some awareness about the health and prevention. I really work hard for preventative medicine. Once anybody gets sick, of course, we have to take care of them and treat them. But why don't we all work together to prevent things from happening? Because once the disease process is there, it goes into a cascade. It's one thing linked to another, to another, to another, till a lot of damage has happened. So why don't we catch things earlier? But before that, I would like to also briefly tell you what are the main two differences about the acute conditions and the chronic conditions. Acute conditions are the ones which happen typically cold, cough, flu, for a short time period. You take the medicine, you take some rest, and then you get over with them. And it's a blessing when you recover from them. But some of the conditions, they get stuck with the body. And they stay with you for a very long time, and sometimes till the end, ultimately turning into a terminal illness. The most common chronic conditions are hypertension, commonly known as high blood pressure, hyperlipidemia or high cholesterol, diabetes mellitus or sugar, and obesity. Obesity is not just a social stigma, but it's actually a medical condition. It's a disease. And if anybody has obesity, they may ultimately have all of the other chronic conditions, or most of them. Not always, but most of them. If a person who reaches the body mass index of obesity level, which is 30, they start to have high blood pressure, high cholesterol is around the corner, and diabetes and heart disease, they invariably happen. So the main purpose of going to a doctor and getting yearly checkups is to why don't we prevent the things before they happen? That's why the visits are important. You get your blood pressure checked, you get your weight checked, blood sugar is checked, cholesterol is checked, and we can catch things at a pre-level, pre-hypertension, pre-diabetes, and overweight, rather than it becomes obesity or morbid obesity. So it really is a preventative thing. Some people are very nervous about going to the doctor's offices, or they just come as a formality, get rid of the annual physical, and move on. But it's a very good opportunity for us to talk about prevention. Because once a person is here with a sickness at the office, then we're just more focused on taking care of the things. But the annual physical is really very important, that we can talk about how to prevent. And I love to talk, and I'm always ready to answer any questions if anybody has. So nobody wakes up one day to say, oh, I'm diabetic, or I'm obese, or I have high blood pressure. When a person is diagnosed to have diabetes mellitus, actually, the process has started about 7 years ago. Thank you so much. Yeah. The blood pressure is not just one day high blood pressure. It may be manifested maybe one day when you are under a lot of stress or had a very heavy salty meal. But the process is going on from a lot before than that. Genetic factors, of course, influence, but a lot of the main factors affect how we eat, how we live our lives. So lifestyle plays a very major role in the disease and the disease processes. So if we talk about the weight first, because weight is one of the major things which ultimately affects. So the normal BMI, or the body mass index, and if I'm sure a lot of you know about it, how the BMI is calculated. It's calculated according to the height. So saying anybody's 200 pounds is not sufficient. It is calculated on the basis of height. Somebody who's 6 feet tall, 200 pounds might be okay. But somebody who's 5 feet tall, 200 pounds would be significantly. You can not only feel it, see a person would look a little bit not very pleasant, but as well as the complications are a little bit more. So this is about the weight. 18 to 25 is normal, 25 to 30 is overweight, above 30 is obesity, above 40 is considered as morbid obesity. Regarding the blood pressure, 120 by 80 is the cutoff for the normal. A little bit above 120, even 124, 125 is pre-hypertension. When it reaches the cutoff is 140 by 90, that's blood pressure or high blood pressure. Cholesterol values, normal is 200. And cholesterol is not just very simple because it's actually a lipid panel. We look into 4 things: total cholesterol, the good cholesterol, the bad cholesterol or LDL, and the triglycerides. One easy way to remember is good cholesterol is HDL, happy, it should be high. And it increases more when a person is exercising or walking more, the good cholesterol it goes higher. LDL, lousy, low. LDL should be low, and happy cholesterol should be high. And of course, the values and numbers are a little bit more. If a person gets diagnosed with diabetes, the values have to be much, much lower than for an average person. I once made a mistake of saying like a normal person, so my patient got very upset with me. He said, "So do you think I'm not normal?" So I don't mean to say abnormal, but if anybody's diagnosed with heart disease or diabetes, the values have to be a little bit more. Regarding diabetes, there is a test which is called as hemoglobin A1C. If anybody reaches the hemoglobin A1C of 5.7, it's considered as pre-diabetes. 6.5 is the cutoff for diabetes. So we try to get our brakes on when we find anybody with the pre-diabetes. Because this is a time to hold on, because if we don't let it go, very easily it tips over to the diabetes, and then the complications start to happen. And the complications, if you can imagine that sugar is the poison which is circulating in the blood from top of the head to the tip of the toes. It's going everywhere. So it affects the heart, it affects the brain, it affects the kidneys, it affects the nerves. A lot of people have just been diagnosed with diabetes just because they feel tingling and numbness in their fingertips. And that's because the nerves in the fingertips are affected or in the toes are affected. So once we get diagnosed, we are found to have some abnormalities in the early stages, we try to tighten our defense mechanisms, and we start to talk about either like significant changes in the lifestyle, eating healthy, walking, exercising, drinking more water. Sometimes we start to give medications earlier in the disease. And then the fight starts. No, I don't want to be on the medication. No, I'm worried about the side effects. So I don't get any pleasure prescribing the medications. I would rather give you time and work. And then I always tell myself, I'm also doing that. I'm also trying my best to be the best of my possible health possible, because I want to live for a longer time to enjoy my children and their children. It's a working in process for all of us all the time. But people just avoid the medications, and I also want to give an opportunity for that. But a younger the patient is and is diagnosed with these preconditions, and some of my familiar faces, they know about it, that I try to talk about it a lot. We try to catch them, and we be very strict with them. Because if we catch them early, we can prevent the complications from happening. And come 10, 20 years, nobody dies right away after getting diabetes, but it will stay with you, and then it starts to cause complications. The arteries get hardened with high cholesterol and sugar. The kidneys start to get damaged. So the younger the patient is, the stricter and firmer we should be. Because this little bit, you may not feel anything, but ultimately it's causing a little bit damage to the body organs. And once the damage has happened, okay, we will always still try to control it, but the damage has already happened. So we will just keep it controlled and managed, but why don't we prevent it? or catch it at an earlier stage, and then at least we can prevent ourselves. Some people are genetically predisposed. Mom had diabetes, grandfather had diabetes, so you are very prone to get diabetes. I have a very strong family history of high blood pressure. So when I have high blood pressure, I couldn't avoid it. I got diagnosed, so I started to take the medicine right away because I knew it, I couldn't escape it. So just to prevent the complications, I started to take the medicine. Yes, there are side effects of the medicines, no doubt about that. But we can monitor the side effects. We check the blood work, we check the labs. If anybody is getting any allergic reaction to any medicine, we can always switch and change. But the thing is that if we wait too long, we will miss a lot of good things. I always give the example just holding a balance in your hand, and then you have to always see the risk of leaving the disease untreated for some time is more, or the risk of side effects are more. Of course, whichever is heavier, we have to be careful about that. If the side effects are so significant, I said, no, you should not be taking this medicine. It's fine, we will just work on the other thing or alternate. But you don't have to, you have to remember the disease process is the direct effect. I hear this all the time, the side effects. What is the side effect of this medicine? What is this? Yes, side effects are very important, we take care of it. But what about the main effect of missing this little bit of high blood sugar, of a little bit high blood pressure? People don't want to talk about it. But we have to bring this awareness among ourselves. Hey, catch it early, prevent things from complications. There are so many people who quit smoking once they have a stent placement done, once they have already had a heart attack. Why don't we quit it before that? We are always waiting for the new year to come and then we will start the resolution. No, start the process from today. Nobody can quit in one day, but at least we can start to think about it. We can start the process little by little, gradually, and then it's more sustained. So this is about the chronic conditions, and then I was asked to, and then of course we are going to have some time for questions as well. This is, catching things early is preventative. Once the things happen, of course, the treatment part starts. Among the preventative things, the other important things are preventative vaccines, which we hear a lot about since the COVID. Everybody is more like talking about vaccines all the time. Some of the people are really sick and tired of getting the vaccines. There are some patients who have received each and every booster which has been ever produced in this world, and there are some people still who don't even want to take a single shot. Everybody is different. But Allah subhanahu wa ta'ala has also said, and we have been advised that we have to prevent, we have to take care of our health. So we try to work and we try to teach and guide. And I'm the first one usually in my office to take the vaccine. Any new vaccine, because I don't want to say, oh, you take the vaccine. No, I'm scared of it. I don't want to take it. I'm worried about the side effects. No, I want to take it so I can say cautiously and with confidence, no, I have taken the vaccine too. Flu vaccines, seasonal flu vaccines, we should try to take it. There are some people, oh, I never get the flu, or I get the flu whenever I get the flu shot. Flu shot cannot give you flu. We have to be very clear about that. Yes, people may have a little bit of reaction, the body feels feverish, and that's, in fact, a little bit of fever is a good sign because the body is showing the immune response. I always get very high-grade fever whenever I get the COVID vaccine. But it means it's a good thing that the body is developing up the immune response. Some people are genuinely allergic, and I'm not talking about that, but in general, and people also say that, oh, I got the flu shot, but I got flu, because the flu shot takes about 2 weeks to kick in and develop the immune response. So maybe if you were already exposed to it before, you would get it. The flu shot didn't even get the chance to develop the immunity. The other preventative conditions, and Sister Batul specifically mentioned about, is shingles. Shingles is a very, very painful condition. And if you have seen anybody with shingles, or if anybody has experienced shingles, it is a very painful condition. It involves the nerve roots. So wherever that nerve is supplying, people get the blistery rash. It's especially very dangerous when it affects the face. So people, vision can be affected by that too. The other age-appropriate vaccines are, as according to each age, is getting the pneumonia vaccines after the age of 65, or somebody who has risk factors like asthma or diabetes, they can get it earlier as well. Regarding the preventative, each age has certain specific, for males and females, each age range has specific preventative measures, like getting the pap smears done for women to prevent or check for cervical cancer. Around 40s, they start to have at the age of 40, they start to do the mammograms. Men get the prostate exam done or the checks. The guidelines are changing now. They don't consider it very significant. But if anybody has significant symptoms or family history, better to get it checked. Then as we go further, by the age of 50, the guidelines are changing again for that, is the colonoscopy to assess for the colon cancer. There are other tests also which can be used as a replacement, but still now the gold standard is the colonoscopy. So there are so many preventative things, so many measures. So I think we should always try to be on this end rather than, God forbid, on the other side, on the sickness side. Let's make dua and let's pray together that we prevent ourselves and we all decide that we are going to do healthy habits. We will walk, we will drink more water, we'll try to eat healthy and prevent a lot of complications from happening. I think anybody has any specific questions, I will be, or my husband, Dr. Arshad, will be happy to answer as well. Yes.
So thank you so much for enlightening us today. We really need medical advice from the professionals.
Thank you so much.
So in our family, we have cholesterol and we have cholesterol and sugar problem. So you said preventive is the best way. How do we prevent from getting diabetes and high cholesterol?
Prevention, again, the thing is that getting it checked, annual checkups, getting it checked regularly to see how it is. Try to be careful with the diet and lifestyle, and then we can work on it. If it is showing a little bit, values are slightly higher, then we have to get aggressive and get treatment earlier for the diabetes as well as for the high cholesterol as well.
So you're saying when you have, when you're on the borderline of, let's say, diabetes, you can start preventive care like medicine?
Sometimes we can start as well. Okay. But like I will give an example, like somebody who is obese, the BMI is above 30, very strong family history, father had diabetes, mother had a heart attack, right now that person is doing okay. I would rather, and the blood sugar is like, A1C is about 6.4, 6.5 is diabetes. The blood pressure is 136/90. I think that person would need medication. Because a little tip over, a big holiday, a big good vacation or a cruise is going to tip over the balance very easily. So it's better to catch it because that person is just at the verge of. Metformin is a medication which can be started very early. It's very good for weight loss as well as it controls the blood sugars. So it can be done. Some people who are morbidly obese, and if they get the bariatric surgery done, or they drastically lose like about 100 pounds or 50 pounds, they can reverse the disease processes. We have seen patients who were diabetic and hypertensive and high cholesterol, they started to lose weight and gradually the medicines were cut down. This is my favorite part to do that when I have to discontinue the medication. Oh, we have to decrease the dose. 5-10 pounds weight loss, oh, let's cut it down. Because people start to feel dizzy, lightheaded, the sugars are dropping, so we start to decrease the medicines. So there are instances when people are no more on medications. Yes, it is really amazing.
Assalamu alaikum. Thank you so much. I have a question about plague. How does it start? And you hear so much about it nowadays. So is it something with diet or is it hereditary or?
Are you
Or
talking
both?
about plague?
The plague, which kind of little particles, they kind
Oh,
of
the
fill
plaque, the plaque
Oh, sorry,
formation.
plaque,
No,
yeah.
that's fine.
Okay.
That's usually is related with the high cholesterol. The high cholesterol, ultimately, it's just like getting a drain. If you can imagine a drain, a kitchen sink or drain, and then you have all the slough which is going in there, it starts to get sticky. So sometimes the particles are very sticky, and they start to make a plaque or plaque, as you were saying, and then it is a little rough area, and then more cholesterol and more particles, the bad cholesterol particles will keep on depositing and depositing, and sometimes it happens, and then ultimately it can completely block. And that plaque sometimes can get detached. That's how people have a heart attack as well. Sometimes when it's completely occluded, a healthy artery is like this, and then gradually it gets thicker and thicker, and it's getting narrowed. There's hardly any circulation of blood happening. And heart is a very vital organ. If the circulation is not happening, people develop the severe chest pain, the pressure, and a part of that heart can die also. That's how called as myocardial infarction. So that's why we have to prevent it from. Circulation is very important for all over. If it happens in the brain, that's how people develop the stroke. Stroke is also two kinds. Ischemic stroke when the circulation is not there, and hemorrhagic when the bleeding happens, which is with very high blood pressure. So everything is dependent on, and prevention again, healthy diet, exercise, walk, lots of water, maintaining the blood pressure, maintaining the sugar, maintaining the cholesterol.
All right, thank you.
You're welcome.
Assalamu alaikum.
Alaikum assalam.
What supplements are recommended for both men and women as they get older?
Actually, a healthy person who eats everything on a balanced diet, there's no need for any supplements. In America, people are very fond of taking supplements, and there are about 23,000 people who go to the ER each year by taking the supplements. And these supplements, some of them are not even regulated very well. And they have their pharmaceutical properties too, and they interact with the regular medicines. Some of them are really needed, like for women, like when they are during pregnancy, they need the prenatal vitamins. Women who are breastfeeding, they need calcium and vitamin D supplements. And women, as they are approaching menopause, postmenopausal, calcium and vitamin D. For men, a good multivitamin generally, and if they think that they're not eating very well, then they can take it. But if a person is eating good amounts of fruits and vegetables, fresh meat, chicken, fish, in a balanced quantity, generally they're fine. Okay. Problem happens when people take biotin for hair, another ashwagandha for this, and this for this, and this for that, and they interact. And some of the people who are already on blood thinners, some of these medications, like turmeric is a very good supplement, but turmeric, fish oil, they all are blood thinners. So you have to be really careful taking the supplements as well. Be very cautious. If you are taking calcium and vitamin D, they are uniformly acceptable and they're okay. But men don't need to take too much of the calcium and vitamin D unless they have a known deficiency. Vitamin D deficiency is very common these days. Everybody, almost everybody. And they say, oh, sunlight. Who has deficiency of sunlight in Florida? We have lived in Texas. People were low in vitamin D as well. I think there's something to do with the diet or our absorption or something, or maybe it gets checked also more. Then definitely you have to take vitamin D. Otherwise, no need too much of the supplements.
There's a question here.
Yes.
Apart from blood pressure, is there any other cause of stroke? For strokes?
Stroke, some people have blood clotting disorders.
So is that a result of cholesterol?
Sorry?
Is that a result of cholesterol, high cholesterol?
Not necessarily. I mean, typically cholesterol may cause the narrowing and it may cause the ischemic stroke when the circulation is not very good. High blood pressure may cause the hemorrhagic when the bleeding is there, but some people have a blood clotting tendency. They form blood clots. They may start from the leg, which is commonly caused as a DVT. The blood clot may get detached, and it may go into the circulation. If it goes to the lungs, it may cause PE or pulmonary embolism, or if it circulates and goes up to the brain, it can cause a blockade over there. And again, the circulation is affected.
So we can safely say that high blood pressure is the main cause of...
It's a very major factor.
Major cause.
High blood pressure is a very major cause of stroke. And it's more common in certain races as well, like African Americans, they are very prone for high blood pressure and stroke, but anybody, uncontrolled high blood pressure is a risk factor anytime.
Thank you.
You're welcome. Yes.
Assalamu alaikum.
Alaikum assalam.
Is it healthy to exercise every day, and what time of the day is most healthy to exercise?
Of course, exercise is the best thing for any person, but again, you have to be sure that you don't have any other physical deformity or any other, and then you don't overexert yourself or lift more weights than possible. Timing, I don't think so there is any timing restriction. People who work in nights and days, whichever time you can find, but if you can afford to do it every day, nothing is better than that. But make sure that you're keeping yourself hydrated as well. Okay. Because when people are working out, they're sweating a lot, so hydration is very important. And if you really sweat a lot, then you have to have a little bit of the electrolyte replacement. Too much of the Gatorade is not good, but maybe one out of all the other liquids, you can have some of the electrolyte replacements as well.
Have you heard of wheatgrass, like this nutritional powder? Like I drink it before working out, and I'm just wondering, like, if that's healthy to take every
I'm not
day.
very familiar with it, wheatgrass,
Okay.
but you have to be really, really very careful with these pre-exercise or workout supplements. Some of them are very, very high risk as well. I had a very younger patient, she had developed severe liver damage because of that. So you have to be a little cautious and careful, and just maybe if you start to do something, just make sure you talk to your provider, or once you start, get your liver functions and other kidney functions also checked. Because some people take a lot of creatine as well, which is a protein, and it may affect the kidneys. So we have to be a little cautious about that.
Thank you.
You're welcome.
And for the exercise, your question was that what is the best time for doing exercise? Is it? This was the question?
Best time.
The best time, right? The best time is always early in the morning, right? When maximum oxygen is available and less carbon dioxide and less smoke is in the environment. So your lungs can take more and more oxygen instead of carbon dioxide. That is the best time, of course, if you can afford it. Before breakfast. You know, exercise usually it's good, always good to have an empty stomach. Okay? Empty stomach means that you should not be low sugar or hypoglycemic. You have a certain reasonable blood sugar level in blood, and then you can perform exercise. But with the heavy meal or after meal, if you do the exercise, it is a normal body phenomenon that after taking food, all blood flow run towards the stomach, towards your system to digest your food. So it means that less blood is available for the muscles to do the exercise. That's a natural thing, is God-given, that blood is needed to absorb your food. So it will always divert from whole body to your stomach and intestine and liver, that one. So less blood is available for the exercise or for the muscular exercise. That is the thing. So it's always better to do with an empty stomach. Thank you.
Assalamu alaikum. Would you tell us a little bit about the effect of mental and emotional stress on the impact that it would have on development or the onset of a chronic condition, a physical chronic condition?
That's a very good question. Yes, it plays a very major role, very major role. So just the anxiety or stress can predispose to a lot of different hormonal and enzymatic changes in the body as well. People who are nervous and anxious, their heart rate is high, their blood pressure can go up. Some people do stress eating, so whenever they are nervous or anxious, they start to eat more. Or the opposite, some people don't eat, they stop eating at all. So it can either they can gain so much weight, they can lose so much weight. The blood pressure can go higher, they're not able to sleep, their sleep is affected, so their body function is affected. So definitely stress and mental health is, we can talk about it all day long. It plays a very major role, and unfortunately it's such a sad thing that it's not very considered to talk about as well. People like to cover it, they don't want to mention it or even discuss it with the doctors. And if they bring it to the attention, unfortunately in US, the coverage is not that much for mental health. But still, a lot of the primary care physicians and counselors and therapists can help, and they have the techniques how to reduce the stress as well. And exercise also helps a lot in stress reduction. Yeah, and too much of the stress is going to raise the blood sugar as well, because the stress hormones which are released in the body, they raise the blood sugar as well. So it's not that good.
Just a quick follow-up. I also noticed that people who are stressed tend to actually exercise less.
Exercise less?
Yeah, because they're stressed. They don't want to think about exercise. They have other things going on in their life that's bothering them, and all the healthy stuff kind of falls over the wayside.
Yeah, of course, yeah, it just damages everything. But if we can at least give a little bit of motivation for a person to just get up, get a bottle of water, go out for a good walk without the cell phone, it really helps in alleviating a lot of stress, and then circulation improves and the person feels better. But the stress, if it's getting a little bit more than minor stress, therapist is needed. Therapy really helps a lot. Or if it really is crossing that further level, then there's no harm in getting the medication. There's so many people who suffer with stress and they don't want to talk about it. And once finally they commit to the medication, I've heard people saying, oh my God, why didn't I get the medication before? Why I was suffering all along? It was just a day and night difference. So there are so many things, and your primary care physician, I mean, I treat my patients like my family, and I want them to treat me like like a family member. They can come and talk to me, they confide in me, and it's very hard for me because sometimes today we have 4 generations coming to our office. Great-grandmother, grandmother, mother, the daughter. And it's very hard for me not to talk about the other person. I have to control myself as well, because grandmas usually like to know what's happening. Is she coming to the office these days or not? But this is really very important. We want to treat them like our family. That's why the name of our practice is also Access Family Care. We want everybody to have an access to us. And really talk. Sometimes I have some patients who just come and sit and we just talk. There's no need for any medication, there's no need, but sometimes to talk and to express and discuss really alleviates a lot of things. So if anybody, and if I cannot handle, of course I'm just a family physician. We can take care of a lot of things, but not everything. So we refer our patients to the specialist. I know, at least if, alhamdulillah, I'm here from about 10 years, almost 10 years, in Florida. I mean, I've worked in other areas, but at least I've developed enough good referral network that I can guide my patients to good specialists. This is a good cardiologist, go to this one. This is a good psychiatrist, go to this one. So I direct my patients to the specialist that I would go myself or I trust myself. So we can always help our patients in any, whether it's a male problem, it's a female problem, a gynecological problem. If we can solve the issue, yes. If not, we are always ready to help. And Mustafa is our office manager. He takes care of all the referrals and guides our office staff as well. Anybody, and if you have anybody, and if we don't have them in our referral network, we make sure that we coordinate with them and send the referral request to them. So we try to help as much as possible.
Thank you.
You're welcome.
One last question.
Yes. Of course, there are so many conditions which can be affecting the feet as well, but there is one of a very common condition which is called as plantar fasciitis. Plantar fasciitis, or the arches, because typically our feet are not flat. They are a little bit like this. So when they are, sometimes we, with the weight, the way we are standing and walking, we develop, there is a little sheet underneath which is called as a fascia. It gets inflamed, and there is sometimes heel spurs develop. So if you're resting and sitting for a very long time, when you try to get up, it takes a little while for them to adjust into the position, and then once you start to walk, then you are okay. So comfortable shoes are very important, not to walk barefooted at home. Even at home, you should have some slippers or something which have a little arch support, and walking, weight loss, stretching, so many things which can be done. But these are the basic principles for that. You're welcome.
I think we're kind of out of time, so Doctor, you're going to be around here for a little bit as well. I'm sure people can ask you questions separately as well. That's correct?
Yes, you're welcome.
Thank you so much. We all, as a community, thank you for coming here, giving us this short talk, and for you to kind of be able to connect with everybody and to get familiar with our community. Inshallah, we hope to see you soon again, and inshallah we'll have more of these kinds of opportunities for our community members to be able to interact with professionals like yourself. So thank you again, inshallah.
Thank you so much. Thank you so much.
And we hope to see you soon.
Okay, all right, thank you.
Muhammad wa ali Muhammad, salawat. Inshallah, tawajjuh ziyarat.
بسم الله الرحمن الرحيم. السلام عليك يا رسول الله، السلام عليك يا أمير المؤمنين، السلام عليك يا فاطمة الزهراء سيدة النساء العالمين، السلام عليك يا حسن المجتبى، السلام عليك يا وارث آدم صفوة الله، السلام عليك يا وارث نوح نبي الله، السلام عليك يا وارث إبراهيم خليل الله، السلام عليك يا وارث موسى كليم الله، السلام عليك يا وارث عيسى روح الله، السلام عليك يا وارث محمد حبيب الله، السلام عليك يا وارث أمير المؤمنين ولي الله، السلام عليك يا ابن محمد المصطفى، السلام عليك يا ابن علي المرتضى، السلام عليك يا ابن فاطمة الزهراء، السلام عليك يا ابن خديجة الكبرى، السلام عليك يا ثار الله وابن ثاره والوتر الموتور، أشهد أنك قد أقمت الصلاة وآتيت الزكاة وأمرت بالمعروف ونهيت عن المنكر ودعت الله ورسوله حتى أتاك اليقين، فلعن الله أمة قتلتك، ولعن الله أمة ظلمتك، ولعن الله أمة سمعت بذلك فرضيت به. يا مولاي يا أبا عبد الله، أشهد أنك كنت نورا في الأصلاب الشامخة والأرحام المطهرة، لم تنجسك الجاهلية بأنجاسها، ولم تلبسك ملهمات ثيابها، وأشهد أنك من دعائم الدين وأركان المؤمنين، وأشهد أنك الإمام البر التقي الرضي الزكي الهادي المهدي. وأشهد أن الأئمة من ولدك كلمة التقوى وعلام الهدى والعروة الوثقى والحجة على أهل الدنيا. واشهد الله وملائكته وأنبياءه ورسله أني بكم مؤمن وبيا بكم موقن بشرائع ديني وخواتيم عملي وقلبي لقلبكم مسلم وأمري لأمركم متبع. صلوات الله عليكم وعلى أرواحكم وعلى أجسادكم وعلى أجسامكم وعلى شاهدكم وعلى غائبكم وعلى ظاهركم وعلى باطنكم. السلام عليك يا ابن رسول الله. السلام عليك يا ابن نبي الله. السلام عليك يا ابن أمير المؤمنين. السلام عليك يا ابن الحسين الشهيد. السلام عليك أيها الشهيد وابن الشهيد. السلام عليك أيها المظلوم وابن المظلوم. لعن الله أمة قتلتك ولعن الله أمة ظلمتك ولعن الله أمة سمعت بذلك فرضيت به. السلام عليكم يا أولياء الله وحباءه. السلام عليكم يا أصفياء الله ووداءه. السلام عليكم يا أنصار دين الله. السلام عليكم يا أنصار رسول الله. السلام عليكم يا أنصار أمير المؤمنين. السلام عليكم يا أنصار فاطمة سيدة النساء العالمين. السلام عليكم يا أنصار أبي محمد الحسن بن علي الولي الزكي الناصح. السلام عليكم يا أنصار أبي عبد الله. بأبي أنتم وأمي طبتم وطابت الأرض التي فيها دفنتم وفزتم فوزا عظيما. فيا ليتني كنت معكم فأفوز معكم. السلام عليك يا أبا الفضل عباس بن أمير المؤمنين. السلام عليك يا ابن سيد الوصيين. السلام عليك يا ابن أول القوم إسلاما واقدمهم إيمانا واقومهم بدين الله وأحوطهم على الإسلام. أشهد لك قد نصحت لله ولرسوله ولأخيك فنعم الأخ المواسي. فلعن الله أمة قتلتك ولعن الله أمة ظلمتك ولعن الله أمة استحلت منك المحارم وانتهكت حرمة الإسلام. فنعم الصابر المجاهد المحامي الناصر والأخ الدافع عن أخيه المجيب إلى طاعة ربه الراغب فيما زهد فيه خيره من الثواب الجزيل والثناء الجميل. والحقق الله بدرجة آبائك في جنات النعيم. السلام عليكم ورحمة الله وبركاته. السلام عليك يا أئمة المسلمين علي بن الحسين ومحمد بن علي وجعفر بن محمد وموسى بن جعفر وعلي بن موسى ومحمد بن علي وعلي بن محمد والحسن بن علي جميعا ورحمة الله وبركاته. السلام عليك يا صاحب العصر والزمان سيدي الأمان الأمان الأمان. السلام عليك يا خليفة الرحمن. السلام عليك يا شريك القرآن. السلام عليك يا كعبة الإيمان. السلام عليك يا إمام الإنس والجان. عجل الله فرجك وسهل الله مخرجك وظهورك ورحمة الله وبركاته. بسم الله الرحمن الرحيم. اللهم كل وليك الحجة ابن الحسن صلواتك عليه وعلى آبائه في هذه
الساعة وفي كل ساعة وليا وحافظا وقائدا وناصرا ودليلا وعيدا حتى تسكنه أرضك طوعا وتمتع فيها طويلا.
Inshallah, the tea and tabarak will be served in the